Let's talk about PICO. This video will go over evidence-based practice. It will define PICO from a scenario. It will develop PICO question from the scenario, and it will build an example search phrase. Carroll University's library does have a research guide surrounding evidence-based practice, and I will show you how to maneuver over to it. But what's important is understanding how EBP is used, especially in research. Evidence-based practice allows practitioners to make decisions based on the most recent updates in medical literature. It is a combination of medical research, clinical expertise, and patient preferences to administer the best possible care and clinical decision making. So, how do we get to the research guides? The research guides act as a cheat sheet to nearly every content area. They hold specialized content created by each subject librarian. On the library website, scroll down until you see Research Guides under Research Help and click. After, you are able to search by subject, all guides, or by librarian. I'm the health sciences librarian, so clicking on my profile will show you how to see all of the research guides related to the health sciences. So, how do we get to the research guides? The research guides act as a cheat sheet to nearly every content area. They hold specialized content created by each subject librarian. On the library websites, so after reviewing all of the health sciences research guides, I'm going to select a guide to evidence-based practice. Here, you will see an overview of the definition, EBP components, and the 5 A's of EBP: ask, acquire, appraise, apply, and assess. Creating PICO questions are part of the first A, asking a clinical question. The research guide shows the steps that should be considered when forming a well-built research question using the PICO framework. There are also templates to help build your question and links to outside resources for scenario practice if needed. So after reviewing all of the health sciences research guides, I'm going to select a guide to evidence-based practice. Here, you will see an overview of the definition, EBP components, and the 5 A's of EBP. Ask. So let's define PICO or PICOT. P represents patient population, which can be their age, gender, ethnicity, educational status, or disease or disorder. I, intervention, exposure to disease, risk behaviors, drug treatments, diagnostics. C is comparison, standard of care, gold standard, no treatment, placebo, no disease, type of therapy that will be given or not, absence of risk factor or characteristics. O, risk of disease, accuracy of diagnosis, rate of occurrence, reduce mortality, morbidity, and improve memory. T can be subjective in that it is not always used. In research, it can be helpful to have a time frame because it allows for the search to be more specific. But sometimes making a search too specific can cause for error or no retrievals, so it's a tricky balance. But an example would be over a 7-month period, X, Y, and Z will be followed. Let's review this scenario and see if we can identify the PICO elements and then form our own PICO question. Mr. Garcia has an Achilles tendon rupture. The orthopedist presented him with both surgical and non-surgical treatment options. After learning that minimally invasive surgical management is associated with faster recovery time, Mr. Garcia opted for tendinoplasty. Now, although Mr. Garcia is our patient, we are looking for his current condition to explain our P. So, Achilles tendon rupture would be our P. The I is our intervention. Mr. Garcia opted for tendinoplasty, so that would be our intervention. What is it being compared to? Well, the opposite option was surgical treatment. So surgical treatment would be our C. O is our outcome. What are we hoping for? We are hoping for a faster recovery time. I'm going to use the template that was found on the Evidence-Based Practice Research Guide to help me form my question. All I'll do is plug in the PICO elements. So in blank, how does blank compared to blank affect blank? And if we want it to be above and beyond within blank, our time frame. So here is what that looks like. In patients with Achilles tendon ruptures, how does tendinoplasty compared to surgical treatment options improve patient recovery time? I will expand on the search phrase in the next video, but this is an example of what our search phrase might look like when we are in the databases ready to look for literature. We want to pair our P, our I, and our O into a search phrase using Boolean operators and, or not to combine the two key terms. Sometimes the C is not always used, but again, I will get into this into the next video. Thank you, and as always, please know that the library chat and our appointments are available for you to use for any questions that you may have.